Well, thanks for joining us for In Focus. I'm Jennifer Lewis Hall. Our focus today, men's health and the importance of prostate health and awareness as we talk about prostate cancer and what you need to know. We'll look more closely at the numbers in a moment. But other than skin cancer, the American Cancer Society says that prostate cancer is the most common cancer in American men. Our first guest is Dr. Alexander Kutikov, an associate professor of urologic oncology at Fox Chase Cancer Center. Welcome, Dr. Kutikov.
Jennifer, thanks so much for having me.
It's great to have you here. One of the most important things to really start out the show talking about is that this isn't only tremendously important to men, but to the men in our lives, our brothers, our fathers, our sons. Why is it so important that everyone get involved, all of us?
Absolutely. Like you said, prostate cancer is the #1 cancer in men and is the second leading cause of cancer death in American men. What's really important to understand, however, is that prostate cancers differ. They're cancers that lead to serious disease and can claim people's lives, but over 100,000 men every year are diagnosed with a very low-risk cancer that can be monitored and can be watched. And that's a very important message to get out there, that even if prostate cancer is found, it does not always need to be treated.
We have some information about prostate cancer and, as you said, how common that is, and extremely common among certain populations as well. We're going to talk more about that throughout the show. But this telling us here that in 2016, estimates in the U.S., about 180,000 plus new cases of prostate cancer, and 26,000 of those deaths from prostate cancer is the result. So much needs to be done in terms of awareness and health. How can we all get involved before we crunch the numbers and talk more about that in terms of making sure that those we love get checked out?
Right, absolutely. And those numbers, what they tell us is 1 in about 7 men in their lifetime will be diagnosed with prostate cancer. But only about 1 in 40, 1 in 39 or 40 men will pass from the disease. And actually, there's over 2.5 million men in America who have been diagnosed with prostate cancer, remain healthy, and live with the disease. So this is one of these cancers where it's critical to understand that this is a disease that is manageable, that is almost always treatable, and sometimes becomes a chronic disease that even when you can't cure it, it is something that you live with.
And it's something that you're saying that you live with, and that is where Fox Chase and other hospitals come into play. Something that I read about that you all had sent me, it talked about active surveillance. Let's talk a little bit about that, because you said it touches and reaches so many. So what are you doing to deal with this? In certain communities, it is really a crisis situation.
Absolutely. So people know about prostate surgery, prostate radiation, but the one message that really needs to get out there, that one of the key options available to men now is this management option of active surveillance. Active surveillance is a strategy where men are not treated, but they're watched very carefully with series of blood tests, with MRIs, with biopsies, and to make sure that the cancer doesn't get worse, but it really affords them an opportunity to stave off the side effects of treatment and to live full, healthy lives. And what I tell folks, sometimes patients come to me and they say, "Doc, I'm so emotionally invested. Why don't I get treated now? Why should I wait? Why should I sort of delay my treatment?" And I tell them there's sort of 3 reasons to really think about active surveillance and consider it strongly. Number 1, it's safe. We know that men who get treated immediately compared to men who get treated later do just as well. There's little risk in waiting and delaying the treatment. Number 2, it gives you more years without the potential side effects that can come with treatment. And number 3, this is a space, this is a field where there's so many advances that even dragging one's feet for a little bit, for a few years, can give you opportunities to harness some of the things, some of the treatments that are still around the corner that we don't know about.
And you're saying, and that can prolong life as well as wellness and healthy lifestyle in folks being treated for this, diagnosing this early, and you're saying active surveillance dealing with that. We have another full screen to put up talking about deaths in prostate cancer and talking about, again, this being the second leading cause of cancer death in America for men, behind only lung cancer. About 1 man, it says here, in 39 will die of prostate cancer, a serious disease, but you're saying many men diagnosed with this cancer do not die from it.
That's right. That's right. People are more likely to die with prostate cancer than of prostate cancer.
Why is that the case?
Because there's just a very large portion of prostate cancer that is so slow growing, so slowly progressing, that men just live their lives and something else catches up to them. Where, you know, a lot of elderly men get diagnosed with prostate cancer, and somebody in their 70s and 80s, sometimes the natural history of prostate cancer is 10, 20, 30 years, and men pass from something else in their, you know, later in life.
For folks even looking, and I want to get to this before we even go to the next segment of the show, just to give, again, an overview, Dr. Kutikov, of, you know, we hear a lot about breast cancer, 1 in 8 women. We hear a lot about different types of cancer, but cancer of the prostate, in layman's terms, describe that for us, and what do men at home need to know?
Well, it's a cancer that only gives one symptoms at late stages of the cancer. A lot of the times you don't have any symptoms, so it's important to speak to your primary care physician, to your urologist, about the pros and cons of prostate cancer screening. It's not as clear-cut of an issue as we used to think, where everybody needs to get screened. People need to get educated about screening, need to understand what the downsides of screening are and what the upsides are, and make their own decisions about screening. How
have people received this whole concept of active surveillance? At first, is it like, well, if I do this, does that mean I'm automatically going to have a diagnosis that's going to be negative? Or you're saying, you actually say this is a positive thing to do?
Absolutely, absolutely. But like you said, it's an incredibly stressful time in people's lives. It's a jarring event. All of a sudden, you get diagnosed with a cancer. You see the pathology report. It says cancer on it. It is very difficult to deal with. And actually, at Fox Chase, we're opening a trial. It's a National Cancer Institute trial that will help men, hopefully, to manage the stresses around the diagnosis of prostate cancer. Men and their spouses or partners are eligible to enroll, and it's an 8-week health maintenance course that promotes basically health maintenance and overall well-being. It's a course that teaches men to cope with the stressors, with the uncertainty of the diagnosis. We're very excited about it because it doesn't only allow us to manage their cancer, but also allows us to manage their overall health. It's sort of a jumping-off point to, you know, to use their cancer diagnosis as a jumping-off point to improve their overall health.
And you're saying that this also opens the door for safer, better treatments down the road. How so?
So what we know now is that not all prostate cancers are destined to get a man into trouble. And what's really exciting is that the molecular and genomic signature markers are now being developed to really understand which cancer is destined to get someone into trouble and which is not. And right now we're using those in clinical practice, but more and better markers are coming on. So those, you know, those 100,000 men that get diagnosed with low-risk prostate cancer, some of them will progress. How do we identify those better, and who needs, you know, who will need to get treated and who's never destined to need to be treated? And we're, you know, that part of medicine is really developing very rapidly, and you know, better risk stratification is really just around the corner.
So that's actually really good news. You're saying the research is being pushed forward to really figure out more about this disease, and then therefore hopefully how to treatment or what treatment therapies would be more effective.
Absolutely. I mean, it's all about matching the aggressiveness of the cancer to the aggressiveness of the treatment. So a lot of the times in the past we said, you have a cancer, we're going to take out your prostate, we're going to radiate your prostate. We now understand that not every time is that necessary. Some of these cancers are just so slow growing that the man does not have to risk the side effects of the treatment in order to stay healthy.
All right, Dr. Kutikov, thank you. You'll be back with us in just a moment. Still ahead on In Focus on PHL17, prostate cancer screening and early detection. Stay with us for that. Very important.